What if I told you that 1 in 5 of the people watching this speech will suffer some form of mental health disorder in the coming year? Well, that statistic is backed up by the Behavioral Health Trends in 2015 by the Center for Behavioral Health Statistics and Quality. Even if you are not the one suffering from the disorder, you very likely interact with someone every day who does. As a research assistant for the past few years, I've been able to see firsthand the biological implications that this disease have. Not that it's just something these people make up in their heads, but a biological thing that we can see and study that causes these. Also, outside of my professional work, in my personal life, I have many family and friends who have dealt with these diseases, and I try to help them as well. So I can speak from that aspect as well. Over the next few minutes, I would like to go over the prevalence of mental illness in the United States, potential causes and treatments, as well as some economic implications. So first off, for the prevalence, like I previously stated, that 1 in 5 Americans will suffer some form of mental health illness in the coming year. That article also would go on to say that the most affected age groups of mental health illness are ages 26 to 49, and then second, ages 18 to 25. And it would make sense that those age groups are the most affected. You know, you're thrown into your life, you have to figure it out yourself, and you have a lot of stresses. But the article also raised an interesting point that the largest raising class with raising percentages was that of our youth, going from 8.5% in 2011 to 11.1% now. And that is a disturbing statistic. The most common mental health illnesses are anxiety and depression, which was reported in a 2005 article in the Archive of General Psychiatry titled Prevalence, Severity, and Comorbidity of 12-Month DSM-IV Disorders. That article also stated that 18.1% of the U.S. adult population will suffer an anxiety disorder, with 22.8% of those being classified as severe, so something that impairs their everyday living. And it is important to note that anxiety and depression are what known as comorbid, or that they're linked or occur together. And that finding is also backed up in a 2016 article titled Prevalence of Combined Somatic and Mental Health Multimorbidity Patterns of Age, Sex, and Race, and it was published in the Journal of Gerontology. And if you would like some more statistics, I encourage you to go to the National Institute of Mental Health. But for now, let's move on to some causes and treatments. If I boiled it down to the most simple cause of anxiety and depression, it would be that of brain chemistry. We have these things called neurotransmitters, which are highly affected in these disorders. The 3 most important neurotransmitters in mental health are serotonin, or your feel-good hormone, your norepinephrine, your fight or flight, which is very, very important in those anxiety, and last, GABA, which is your main inhibitory. So if it would be pain or any other thing. And that is also the neurotransmitter most affected when people drink alcohol. So when looking for the treatments for these mental health disorders, they often look to the serotonin. And that's why we have drugs called selective serotonin reuptake inhibitors, or SSRIs. For very popular brands may be that of Prozac or Zoloft that you may have heard, or you have family members that take. What these do, they try to trap that serotonin and keep it in your brain so you have more of that feel-good chemical in your brain, so you can kind of go out of that depression or anxiety. Another common treatment that is brought along with the drugs is that of cognitive behavioral therapy. And that is where you go in with a trained psychologist or a psychiatrist, and they will do that therapy. But it is also most effective when combined with a pharmacological treatment. And in my research, we've also seen lifestyle changes having drastic impact on these mental health disorders. So just doing simple things such as exercise and eating healthy have almost completely reversed them in many cases. And We're thinking this could be caused by just a simple thing is called gut microbe change. So when I exercise or eat healthy, I promote good bacteria in my gut. And you can see a very drastic difference between people with anxiety and depression and those who don't. And adding in these things like eating healthy and exercising shifts that microbiome back to more of a normal level. And so that's just a little tidbit. It's not technically published yet, but I'm pretty sure of the findings. But according to that same sort of the behavioral health trends in 2014, only 41% of people with a mental health disorder will get treatment in the coming year. And that is also a sad statistic, and a lot of the research I was reading was due to just the stigma that's placed. So I hope that this speech helps to reduce that stigma, maybe in your minds just a little bit. But finally, let's look on what impacts this could have on the economics. The World Health Organization in 2010 article titled "The Global Status Report on Non-Communicable Diseases in 2010" stated that globally, mental health illnesses will cost us this year, or by 2030, is estimated to cost us $6 trillion. And in 2009, cost us actually $5.1 trillion. So it's a very costly thing. And major depressive disorder, which is one type of depression in the United States alone, cost $215 billion in 2015. And that was backed up by the journal Psychiatry, Economic Burdens of the Adults with Major Depressive Disorder in the United States. So as you can see, there's a very drastic economic impact as well. But now let's wrap things up. So we looked at the prevalence of disorders in the United States. We looked at potential causes and treatments, and then we also looked at the economic impact. So I hope you keep this speech in mind as you go to maybe pass judgment on someone who might be suffering from a mental health disorder, because it's very common and they very likely do have that. Or, and lastly, maybe if you're going to vote on some form of ballot issue that could maybe fund some research and treatments for people with these mental health disorders. And lastly, I just really want to thank you for your time and watching to this speech, and I hope you stay healthy. Thank you.